Congratulations on the 35th anniversary of Ronald McDonald House. My name is Rick Ohye. I'm one of the pediatric heart surgeons here at CS Mott Children's Hospital. I've been here, I think, about 22 years or something like that. So not quite 35 years, but certainly a lot of overlap with Ronald McDonald House. A little bit about our program. So we're one of the bigger congenital heart programs in the country. So we have very high volume. We do maybe 1,000 total cases a year or something like that. And as a big program, we get patients from all over the place. Probably, well, I can say that we have patients from all 50 states and 60 countries and counting. We're a program where maybe up to about half of our patients actually come from out of region, meaning more than, say, 2 or 3 hours of drive time. So having a resource like Ronald McDonald House for our patients is extremely important because they're away from home. I mean, and like I said, in many cases, they're even out of their own home country, much less from a different state. So for our patients, having Ronald McDonald House nearby is really, really important. Some of the kids are here for a very long time. I have a patient right now who, between our hospital and another hospital, has been in the hospital her entire life, and she's 16 months old. So she has never been home. And so to have someplace like Ronald McDonald House for her family to live and to be together with her is super important. And she's not the only patient that's been here for weeks or months or even years. Those patients that are here for a long time, it becomes their home away from home, and a place where they can be with their families, and a place that feels a little bit like home and doesn't feel like a hospital room, and it doesn't feel like a hotel room. I think that's the important sort of gap that Ronald McDonald House fills for these families. I think that one of the important pieces that Ronald McDonald House supplies is a feeling of community, and so they're there with other families that are experiencing the same thing. They're not at, the Motel 6, where they're the only person there that's having the experience that they're having. You have the ability to interact with all these other families that each have their own story to share. And I think it makes it so you're not so alone, whether it's just have to sit down to talk to someone who's a sympathetic ear or to share a meal. I mean, I think those things are something you can't get if you don't have something like the Ronald McDonald House. For anybody who's watching this video, is to get involved. This is run by everyone's donations, everybody's goodwill. It's done by people getting involved, people in the community, people coming to cook meals, to help take care of the house and take care of the families. So I would ask everybody that sees this to consider getting involved with Ronald McDonald House, because it is an amazingly important resource for our patients. And I think you'll find it extremely rewarding to be involved.